Okay, so this is my patient case, Laurel. And yeah. So some background information. Laurel is 32 years old. She has a 5-year-old daughter. Is a marketing executive in Hong Kong after living in the U.S. for 10 years. And the main background information here is that she has been recently experiencing bloody episodes of diarrhea 7 times a day. And these episodes have resulted in her becoming weak and has led to her experiencing abdominal pain. I have three possible hypotheses that I came up with after doing research. And the first one is dysentery, which is an infection of the intestines, which causes bloody or mucus diarrhea. And those are the symptoms listed below. Next is colitis, and that is when there is an inflammatory reaction in the colon. And those are the notable symptoms. And this is the one that I found that connected to the patient's symptoms the most. They were almost identical. And the final one final possible hypothesis was the diverticulitis. And this is the inflammation or infection of pouches that can form in one intestines. And these were the symptoms listed below. And there's a little picture there. And some of the learning issues that I had here so the first one, as you can see there, is urea levels can indicate kidney failure, and this can be found through blood, urine, nitrogen testing. And then the next that question I had was, what is a normal white blood cell count? And after some research, it said for women, a normal white blood cell count is 4,500 to 11,000 white blood cells per microliter. And what do hemoglobin levels indicate? Was my last one. And if your hemoglobin is low, it indicates that you have a lower red blood cell count, and this also means that you might have anemia. And this is a slide discussing small and large intestine, which connects to colitis. So here's a tube. A small intestine is a tube about 20 feet long, and it absorbs the nutrients from what a person eats and drinks. And then large intestine is a tube which is about 5 feet long, and the colon absorbs water from waste and creates stool. So yeah, down there where in the large intestine area is important because colitis is when the lining of the large intestine becomes inflamed or swollen. So that is why it connects with that. And so my conclusion for this patient case was that she has colitis. And to diagnose this, I performed a colonoscopy, which is a colonoscope, which is inserted through the rectum with a camera. And this allows the doctor to see the entire colon. And then the next reason why I diagnosed Laurel with colitis was because the symptoms in this case were pretty much identical with colitis, with the abdominal pain, the diarrhea with blood, and the fatigue that she had mentioned. And the final reason was that one of the major trigger items for colitis is coffee or is caffeine, rather. And Laurel mentioned in her background information that coffee has been a big part of her life, as she drinks it pretty much every morning. So that could be a cause as well. And then so as a result of this, having colitis, she may have to deal with bowel urgency and incontinence, which may affect her daily life, but won't be too much of an issue. And another thing that can help her deal with colitis is trying to change her diet a little bit. So there's some foods that kind of aggravate this issue, and also so they're known as trigger foods. And you should stay hydrated throughout the day and try to eat 4 to 6 meals to have a healthy life with colitis. And finally, sorry if this was off. The treatment that I found were, so there is no long-term cure for colitis. Yeah, you have to live with it. There's no getting rid of it per se, but there are a variety of medications that can be taken to relieve inflammation and help Laurel go on with her daily activities and live a pretty normal life. So a short-term medication, a specific one is amino salicylates. So they're usually safe, but there are a few side effects listed there, which are headache, nausea, abdominal pain, loss of appetite, and fever. So yeah, that's a one option that can be taken there. And to finally, the bedside manner that I will present Laurel with this information, I will describe her the symptoms associated with colitis to be transparent with her from the beginning, and then how it matches her symptoms to make sure she understands that this is the correct diagnosis, and to keep a positive attitude to keep her calm as well. And these are my sources. Thank you.